Good morning. Today we're going to be talking about low back pain, which is a very, very common symptom in so many of us. Good morning, Dr. Badmus and Mrs. Osindero. It's a pleasure to have both of you on the program.
Good morning, and thanks for having us.
Good morning.
So Dr. Badmus, if I can start with you. You're a specialist spinal surgeon, and I know that, just to talk generally about low back pain. Low back pain is a very common symptom, isn't it? Can you tell us about what causes it in general? And, let's just start with, what are the general causes of low back pain?
All right, thank you so much. Yes, as you've mentioned, low back pain is pretty common. The statistics we tout says 80% of people will experience a significant episode of lower back pain in the course of their lives. And it's also accepted in most Western countries where there's a lot of data as one of the most important causes of loss of time to work and also significant economic impact. The causes of lower back pain are quite a lot. There are things we call non-specific causes, and this is when after you've looked at a person and you've looked at everything regarding them, you cannot find a structural problem with their spine that is causing their pain. When you can find structural causes, then you will call that a specific type of lower back pain. The causes of lower back pain is anything that can affect the components of the spine in the lower back. So it can be things like injuries, nerve compressions because of the nerve tissue that runs within the backbone and exits to all parts of the body. You have infections, and one common infection is tuberculosis because Nigeria is in a TB endemic area. There are cancers and non-cancerous lesions. There are deformities, and then there are inflammatory disorders. For example, rheumatoid arthritis, and all of these can be causes of lower back pain. But as I've said, there are a lot of other non-specific causes of lower back pain where we really find nothing. And that's where we then look at things like muscle function, posture, and stuff like that.
Now, you've defined it between, the different types, specific and non-specific. But then there are also other ways to classify them, aren't there? So in terms of, can you explain a bit more about the different types of back, the specific ones?
All right.
And how will people know what they have and when they need to come and see a doctor?
Yeah. All right. So when back pain has been on for less than 6 weeks, we will refer to that as an acute lower back pain. When back pain has persisted, either coming on and off or in a continuous fashion for more than 6 weeks, we will address that as a chronic form of lower back pain. Obviously, the timing is really with just trying to help people to distinguish the kinds of pain that requires advanced imaging like MRIs and CT scans, because in most acute lower back pains, if there aren't things we call red flags, then you really don't need to do an MRI immediately. You can sort of give the person general treatment to get the pain down. And if their pain goes down, then you can leave them without doing expensive tests. And those red flags just include things like, having pain that isn't worse at night, because when pain is worse at night, that tends to be something that has a specific cause. And those things tend to cause problems if they are left unaddressed promptly. We look at neurologic symptoms, if there's a history of trauma, acute lower back pain in elderly people, and then also people with a history of treatment of cancer, whether ongoing treatment or treatment that has happened in the past.
Now, you mentioned the word trauma. Can you just tell us a bit more about trauma? And
so trauma is simply just a damage to tissue because of application of force to the tissue. and that can happen in varying circumstances. It can happen in falls, in road traffic collisions of different types. It can happen in the gym when people, put some of their tissues under abnormal stresses. So that's basically trauma. It's just damage to tissue from application of excessive force.
Now that's very interesting, because that what you've said covers a very, very wide range. Are there any
Yes, it
particular
does.
things? Because I mean, I had a specific incident myself in December where I had an injury and then I had pain shooting down my leg. So, are there any specific things to do with the lower back pain that people need to also look out for? And you haven't told us when specifically they have to see a doctor. I'm still coming to when they would need surgery, but first, when should they come in to see the doctor? And then when in the course of that, would they need to be considering surgery?
Okay, so when to see a doctor in lower back pain, any pain that is so severe that your common pain medications aren't working, aren't helping, pain that has gone on for more than 2 days, you really should see a doctor. And the doctor is a general practitioner, a family physician, because they will be in the best position to ask questions and be able to reassure you and also give you appropriate pain medications that you might not be able to get over the counter or, need to use in specific ways to avoid side effects. So that would be my thought. In terms of when to refer to a specialist, that's a completely different thing. So I don't expect that people with lower back pain will come to see someone like me straight away. It would be, just sort of general care, and most people will improve with given some time. And obviously, there are those red flags we talked about, and those are very important because those select out patients that really do need to have an urgent MRI and probably need a referral onto a specialist earlier rather than later.
Can you repeat those red flags again for those who didn't catch it?
So those red flags are pain that is worse at night. If you have a definite pattern of pain that is worse at night, that is something significant. If you've got symptoms of neurological symptoms, nerve pinching, pain going down the leg, weakness in the leg, weakness in the arm, you've got tingling sensations, those are not symptoms to sit on. Those need to be assessed. We need to know exactly what is causing them, okay? History of cancer, if someone has been treated for breast cancer, either treatment that is ongoing or treatment that has been in the past, even up to 2-3 years, and they develop significant back pain, those always need immediate assessment. You've got unexplained pain in an elderly person, again, because this sort of things like cancers are more common in that age. We have a low threshold for doing imaging. And of course, if you've got pain because somebody's been injured in a road traffic accident, they've got significant back pain, those need imaging immediately because you need to rule out that there is no bony fracture or bony injury.
Oh, wow. Thank you so much. I think this is really quite comprehensive. And so the first thing they would do, in the old days, they used to do x-rays, and now they do MRIs. Is there still a place for x-rays at all in lower back pain?
In most lower back pain, one would be hard-pressed. And the reason is because x-rays are quite, they're not very great at telling us a lot. I mean, so in advanced problems, if you do an x-ray, it might reassure that it's not so bad, but it really doesn't tell you what is there or not there. So really, in most situations, x-rays are not the most appropriate by today's standard of care. But then if it's a trauma, a fall, a road traffic accident, an x-ray can be a great tool. But obviously, you then need somebody who can look at that X-ray properly and very closely, not to miss injuries.
Okay, so that's why, because one of the things people ask is, these MRIs are so expensive. Why is it the doctors keep rushing there? Why can't we do something simple like an X-ray first? So I think you've answered that. So when we have this X-rays, when we have this lower back pain, it's got those additional symptoms, and we've had to come and see a specialist such as yourself. Nobody wants surgery, but when would, what would be the course of treatment? You've talked about diagnosis. What kind of course of treatment would you do, and when would it be necessary for people to know that they have to have surgery? Because we don't like having surgery as Nigerians, but sometimes it's necessary, and so we don't want to have to, delay. So for those who are listening, when would it be imperative?
All right, thank you very much. And this is very important. One of the things about surgery is that there are rules where you've got to make sure that you're only recommending surgery when it will actually help. And we've got a lot of data now, because in many countries all over the world, many surgeries have been done in the past with regards to lower back pain. We've generally found out that there are situations where it just doesn't seem to help. So overall, with most lower back pain, the initial treatment will be what we call non-operative or conservative. And that will stretch from, there are different modalities. Medications is one, there's psychotherapy, where you do cognitive behavioral therapy. There's physiotherapy and other physical forms of therapy. And there's weight reduction when that is appropriate. I mean, we don't say that obesity or abnormally large weight for height causes back problems, but we know that in people who do have back problems, having more weight than you should does actually worsen the symptoms. So control of weight, reduction of weight is a very critical step. So most lower back pain will be treated without surgery. This is what is most appropriate often. When we think surgery is most appropriate, and that could be immediate sometimes, you've got back pain and there's a specific cause, and that cause of back pain is causing an instability of the spine. If you remember that the spine is a load-bearing structure, it is carrying the weight of the head, the chest, and the tummy, and transferring it to the pelvis and the legs. And therefore, the spine has to be stable enough to retain its, a normal shape, a normal alignment while it is doing that. When the spine loses the ability to do that, it will cause a lot of pain. It may cause nerves to become injured in the process from displacement, and that's something that generally needs a surgeon to sort out, okay? If someone has got nerve problems associated with the back pain, and those nerve problems are worsening, there's worsening weakness in the legs, they're struggling to walk, they often will end up needing surgery, okay? So there are quite a number of scenarios. So even infections, sometimes you need surgery just because you need to get a little sample of tissue from the area that is infected so that we can know exactly what germ is causing the infection. We can know from the pathologist what is the sensitivity in terms of what antibiotics are going to be most useful in that infection. So that is one indication in an infection. Infections can also cause instability. You know, infections can cause compression of nerve tissue, and that can lead to disabilities. And we want to sort that out with surgery because it is time sensitive. So these are sort of broadly the situations that demand surgery. When there isn't significant nerve dysfunction and there isn't instability, you have time. to try out different modalities and see whether they work or don't work. And the time frame for doing this would be something from 3 months to 12 months.
Thank you. Thank you very much. Dr. Badmus spoke to us about the importance of physiotherapy as a treatment modality in the treatment of lower back pain. Can you tell us a bit more about that?
Thank you very much, Dr. Pamela, for having me here. As Dr. Badmus has spoken about earlier, in terms of the low back pain, physiotherapy definitely plays a huge part in the management of low back pain today. We're able to have a huge impact in the way patients see. I'm sorry, I'm now really thrown off. I'm really sorry about that. I'm really sorry. Sorry. Let me just do that again.
Start again.
Yeah, I'm just going to start again. Sorry. Thank you very much, Dr. Pamela, for having me on the show today. And as we've mentioned, physiotherapy plays a very key role in the management of low back pain. We're able to do that through many ways. One of the most important ways that we are able to have an impact on our patients' life is through advice in terms of the condition. Because low back pain is something that patients or everyone sort of experiences all throughout their lives. Most people tend to have not just one single attack, but a recurrent attack. So, and this is really, really linked to a lot of lifestyle. So a key part of our intervention is providing a lot of advice on lifestyle. We're also very effective in providing mobilization exercises as well as stabilization exercises, which we teach to our clients so that they are able to improve on flexibility and muscle strength so that they're able to have a much stronger back in order to prevent more pain coming across. We also speak to our clients in terms of ergonomics advice, making sure that we all understand the importance of our posture when we're sitting, when we're standing, and pretty much throughout all activities of daily living. And then also postural guidelines, just making sure that people also understand the ways in which their posture affects their lower back pain.
Thank you. And I know there's a lot that the physiotherapy does in terms of pain relief, and there's so many things that you do in terms of relieving pain. As I mentioned earlier, I had an incident in December. I must say physiotherapy was a very huge part of my recovery, and I do appreciate what it is you do a lot. Doctor, how much are you involved in the treatment of lower back pain, particularly after surgery, as a physiotherapist?
Oh, we're very heavily involved in treatment of post-surgical rehabilitation following lower back surgery. One, pain management. Typically, when a patient comes out of low back surgery, one of the first things that we try and manage is their pain. As you can imagine, any kind of surgery is going to involve cutting through muscles and soft tissue. And as such, we work hand in hand with the patients and the doctors and all the team involved to make sure that we are able to help manage the pain. And so there's less reliance on medication. And also posture. When you're coming out of back surgery, there's a lot of weakness in the muscles that have been tampered with. And again, just by providing advice on the kind of positions that you can move into, we're able to also assist with not just the pain, but also provide, how would I put it? Flexibility to the muscles, which are also healing. And then, of course, we can go into the typical exercises, mobility exercises, strengthening exercises, flexibility exercises, depending on the kind of surgery that was given, would depend on the kind of intervention and the type of exercises that we give. We also provide cryotherapy as another way in which we can manage pain. So there's a very strong input of the rehabilitation team right after a low back surgery.
Thank you. Dr. Badmus, going back to you, I understand that we now have a brand new center, the Cedarcrest Hospital, which has recently just been opened in Victoria Island. Can you tell us a bit about it?
Oh, yes, happily. Thank you. The Cedarcrest Hospital Group is a brand that has been in existence for about 15 years plus now. Obviously, began in Abuja, but now there is a new facility on Muri Okwala Street in Victoria Island. This is a state-of-the-art 55-bed, 5-floor or 6-floor, if you consider the terrace hospital that is dedicated in its to serve as a multi-specialist orthopedic center. And it is leaning on the experience of a wide range of internationally trained, practiced, experienced surgeons covering different aspects of orthopedic care. The particular areas of skill, and some of these guys who are working there are guys who've worked in the US, trained in the US, worked in the US, in the UK, and stuff like that. Joint replacement surgeries, foot and ankle. These are some of the subspecialties of orthopedics. Pediatric orthopedics, we've got a vascular surgeon, and then we've got back and spine, which is my baby. And then we've got, of course, trauma. And one of the things that is notable about the practice of orthopedics in this situation is that this is people who have subspecialty training and expertise. And we've designed a building and equipment and support around their practice to provide world-class care to people of Lagos, right in Lagos.
Fantastic. We always appreciate it, particularly when our diasporans come back and provide it. So this is another wonderful addition to our specialist care in Lagos. Thank you very much.